Now let's move to the next virus, which is the herpes. Herpes family. Now the illustration will be much quicker. You will know that we won't waste any time. But before we start discussing the drugs of herpes, I need to remind you something about the herpes virus. The first piece of information is that it's a DNA virus. Never forget this. The family of herpes are DNA viruses, unlike the HCV. The second piece of info is that this family is not made of a single virus but 8 viruses. 8 viruses that form the herpes family. The first one is called type 1, herpes simplex type 1. This is the virus that we all have after the common cold and makes an inflammation on the outer border of the lips. Those painful inflammations, and sometimes it causes inflammations in the eyelid. Thus, this one causes mucocutaneous infection or inflammation. This herpes simplex type 1. Type 2 is exactly the same. It also causes inflammations and vesicles, but this time in the genital areas. Thus it's called the genital herpes. The third type, herpes type 3. This one's called Varicella zoster virus. Its name is Varicella zoster virus, VZV. This type belongs to the herpes family. It's one of the members of the herpes. However, it's very characterized by causing something called chicken pox in the little ones, which is a rash with small itchy blisters. The small kid becomes feverish and some red spots starts to appear on his body. Some days after, and everything goes away without problems. Don't forget that in the past video I told you, any DNA virus implants itself in your genome forever, which means this child who had the virus type 3 and experienced the chickenpox, forever he carries the virus in his body. When he gets older and the virus becomes activated for any reason, his immune system is weakened or he took an immune suppressant and the virus starts to be activated, it will cause a problem, but not like this one. This time it will be localized to one area of the body. This rash and vesicles won't be all over his body. However, the inflammation will be limited to an area of the body and it's called shingles or herpes zoster. You may see someone about 40 years old, suddenly a part of his body, a cutaneous dermatome or a certain area in his body, it follows a certain distribution, which is the distribution of the cutaneous dermatomes. The area that's supplied by a certain nerve, it follows this distribution causing the inflammation or the painful vesicles. Very painful. Once you see this, you will know it's the virus which is called Varicella zoster virus. Then did this man caught it today? Impossible. This virus lived in his body for about 40 years, since he was a kid or since he caught the chickenpox. And when he got older, it caused this problem. The fourth type in this family is called Epstein-Barr virus, and it causes a glandular fever, a very large topic. However, it's characterized by tonsillitis, splenomegaly, fever, a very long story. Just remember the virus called Epstein-Barr virus, or the fourth type. The fifth type of the herpes virus, type 5, is called cytomegalovirus. Cytomegalovirus, my friends, one of the family of herpes. The cytomegalo, type 5. This virus is very opportunistic. It causes a disease in the eye, in the retina to be more specific. For who? For the people with the HIV, or the patients on the immunosuppressant drugs. Which means once the immune system gets weaker, this fifth type takes the chance and hits the retina causing a problem. This concept is very important when it comes to the exams. They may give you a case about HIV patient who is very deteriorated and so on. He starts to feel visual disturbance. What happened to him? Tell them surely it's cytomegalovirus retinitis because it's an opportunistic virus. The virus number 6 and 7 are similar. Both of them are considered the same. They cause something like the chickenpox in the children. Something that's very benign called Rosella infantum. Pediatricians know it very well and they diagnose it at once and reassure the patient that it will soon subside. The 8th type, however, causes a type of skin cancer called Kaposi sarcoma. And this type of skin cancer also occurs in the patients who are immunocompromised, like AIDS patients, the patients with kidney problems who underwent a renal transplant and are on immunosuppressants, patients with HIV or whatever. So these are the 8 types of the herpes virus. Don't forget that all of them are DNA viruses. And we have many drugs that swings at all of these types. Sometimes there's a drug that swings at two types, there's a drug that swings at this one only, and a drug for this one only, and so on. Let's see what drugs do we have here, and like we're used to, we will have one page for all of the drugs in order to clear any confusion. Luckily enough, our drugs, or the anti-herpetic drugs, are only one family. We don't have anything for the attachment, unfortunately, we don't have any for the uncoaten, however, all of our game is on this one, on the DNA polymerase, or the step of replication. You may think about this enzyme, the integrase enzyme. Since the virus is a DNA and it must do an integration. Indeed, we could have a drug for this. We could design a drug for the integrase, however, right now we don't have any. What we have is just one family that causes inhibition of the DNA polymerase enzyme, which is specific for this virus, and is used for the replication. Just one family, a very famous drug called acyclovir. Then another similar drug is made and it's called ganciclovir. Lastly, the third and most recent drug that's called famciclovir. They all end with the word cyclo. Let's start with the first one, the cyclovir, since it's the most well known and the prototype. By the way, the three of them are similar regarding the structure, and the three are called purine analogues or nucleoside analogues. And this word was mentioned once, twice, or 10 times in the previous video, where we had the virus structure and its life cycle. I remind you, as you are forgetful or too lazy to go back to the previous video. This is the acyclovir. This one here, this is the acyclovir. I drew it for you to remind you and tell you that the acyclovir is similar to the nucleotide that's normally present inside our bodies. The one that's called adenine. Adenine, when it attaches to a sugar, it becomes adenosine, or generally known as nucleoside. Acyclovir looks exactly the same, thus it enters and competes with the natural nucleotide. So while the virus is replicating and making copies of itself, things become messy and gets confused, since it's a very primitive virus and the enzyme is extremely primitive one, thus no longer knows which one is the natural nucleotide to be used and which one is the drug, because they both are similar, as it's a nucleoside analog. These three are exactly alike. The result is that the virus swallows the drug and incorporates it and is no longer able to continue. Still, there is one thing more I want to add before we move to the next family. These three types of drugs must firstly be activated before they are able to inhibit this step of replication. They must acquire a phosphate group or undergoes phosphorylation to be able to compete and inhibit the DNA polymerase. Okay? What activates them? Or what's the one that adds a phosphate to them? Fortunately, the one that makes this process is an enzyme inside the virus itself called thymidine kinase. Inside the virus itself is an enzyme that activates the drug. The drug doesn't transform into the active form except in the inside of the virus. From here comes the brilliance of these drugs. These three drugs can never affect your body nor cause severe adverse effects on me. Why? Because if I swallow the drug and it reaches all my cells of my body, the drug is inactive. It won't be activated nor interfere with the DNA polymerase unless it acquires this phosphate group by the enzyme that's called thymidine kinase, which is inside the virus. Thus, these drugs are considered prodrugs, guided drugs, targeted drugs, or highly selective drugs. Acyclovir, the first one, targets the herpes virus type 1, herpes simplex type 1, and herpes simplex type 2. These are its two viral targets because it's activated inside these two, and the rest of the 8 types? No, we don't deal with them. Because when the drug enters inside the virus, it won't be activated. It becomes active inside these two, thus it kills these two. Okay, the ganciclovir. It becomes activated inside the cytomegalovirus, which is the type number 5 that causes retinitis. Thus, this ganciclovir is the one for the cytomegalovirus. The famciclovir, the last one. It hunts the virus number 3, which is called the varicella zoster virus, that causes the chicken pox in the children, or it causes the shingles or the herpes zoster in the elder. Then each one drug of these is specific to one type of the virus or a subtype of the herpes family. This could be an MCQ question directly like this. I'll ask you which of these following drugs affects the type number 5, Then it's the ganciclovir. Which of these affects the type number 3? It is the famciclovir, and so forth. Now we finished the anti-herpetic drugs. Let's move to the next family of the influenza virus. The influenza family, or the respiratory viruses in general. Respiratory viruses can be illustrated as this. If you want to illustrate a lecture about the respiratory viruses, those viruses that affect our respiratory system, we have so many of these viruses. For example, we have the family of the influenza that cause inflammation in the upper respiratory tract. Number 2, we have a virus called respiratory syncytial virus. This is such a famous virus worldwide right now, causing outbreaks all over the world and other conflicts. Number 3, the virus that's called corona, which is making this fuss all over the world. These 3 families, or these 3 viruses, the 3 of them are together called respiratory viruses. However, we won't explain them all because we don't have many drugs. What we can explain only is the family of the influenza. We have some drugs for the influenza virus. Thus, I didn't like to make the title Drugs that are used to treat respiratory viruses. Instead, I was more specific, choosing the influenza only. When it comes to the influenza virus, I only have 2 golden chances to hunt this virus. There are no more. The first one is during the process of uncoating. Here in this step, after the influenza virus enters and takes off its coat. Now we can interfere. Why? Because we have a drug that's called amantadine and rimantadine. They were invented in the 50s of the past century, and by chance we found out they are able to hunt the virus during this step. But why? What are they doing exactly? Let me remind you with some information from the first video where we illustrated the life cycle. I remind you with the very beginning of the video when we were discussing the life cycle of the virus. Let me just make this one bigger to remind you with what we said before. In the first video I told you that this is the structure of the most of the viruses. And the viruses have something like pores or channels on their surface. These channels are called proton channels. And the protein they are made of is called M2 protein. That's okay? The virus of the influenza has these channels, or the M2 protein, and the drug called amantadine can target it and close these channels. Thus the virus is not able to do the uncoating. It stops. This step stops. So after the virus enters the cell, it becomes frozen. It's not able to take off its coat as the drug attaches to it and closes these channels. Thus the virus is no longer able to do the process of the uncoating. Both amantadine and rimantadine do this. This is all what you need. Only one word: inhibition of the viral uncoating. But before I forget, if you asked me, could this amantadine inhibit the uncoating of the other viruses? The answer would be no, not for a moment. Because amantadine and rimantadine both targets the M2 protein, or the channels of what? Of the one virus, the influenza virus, and even not all of the influenza viruses. They only target the influenza A virus, the type A, as we have 3 types of influenza viruses: influenza A, B, and C. Amantadine targets the influenza A only. It is a very specific drug for the influenza A. The second chance to hunt down this virus is during the last step, the budding process, or the step of release. Some time ago in the previous video I told you that in order for the influenza virus to get out of the cell and breach the wall, it needs an enzyme called neuraminidase. This enzyme is specific for the influenza virus, doesn't exist except in the influenza virus. Thus scientists decided to hunt it by a drug. Design a drug that targets this neuraminidase and inhibits it. So the virus won't be able to get out of the cell. Accordingly, the cell infected by the virus can die peacefully, and the virus won't be able to copy itself millions of copies. They invented a drug called oseltamivir and something called zanamivir. Oseltamivir is a very well-known drug worldwide, and zanamivir is exactly the same. Both of them cause inhibition of the neuraminidase enzyme. They inhibit the viral release for the influenza viruses only. Because this enzyme is only present in the influenza, they can act on the influenza A, B, and even if there are any other types of influenza viruses. While the amantadine only acts on the influenza A, oseltamivir and zanamivir can act on other types of influenza viruses. There is still one piece of information about this zanamivir. You can add it to your textbook. This zanamivir sometimes leads to bronchospasm. So patients with bronchial asthma, if they receive this zanamivir, they sometimes experience dyspnea and bronchospasm, just in case someone asks you. Let's move to the next family. But before we shift to the next family, here on this slide, I want to tell you something about the amantadine, the previous drug for influenza. It has a very well-known adverse effect that may be a question in your exam. We sometimes pull this photo in the exam. The question is more or less like this. A photo like this one, and below it is a related question. What you see here is reticulated skin. Reticulated means as if the skin had stains, or it takes the shape of a certain pattern. So they sometimes call it reticulated or mottled skin, somewhat like the marble. Amantadine is very well known to cause the side effect on the skin. It gives the skin this mottled appearance, and this effect is called livido reticularis. And here is a photo of the livido reticularis. Why does it occur, or where does it come from? It's because amantadine decreases the blood flow to the cutaneous capillaries. And when the blood flow decreases, it leads to deoxygenation of the blood. The blood loses its oxygen and it becomes stagnant. Blood standing still, without renewal. Thus its color changes and the blood here becomes bluish. And since it's superficial, occur in the superficial capillaries, then the capillaries that were not apparent when the blood becomes bluish or acquire this bluish discoloration, their shape become reticulated or mottled like this. And this adverse effect is very characteristic of the amantadine. In addition, it can also cause some neuropsychiatric adverse effects. If you remember, we mentioned it before during the explanation of the Parkinsonism. In the past, when I explained the Parkinsonism, I told you that amantadine increases the dopamine in the brain. Do you remember when I told you it increases the dopamine by an unknown mechanism? So if the dopamine is increased, it can lead to some neuropsychiatric manifestations and the patient experience a postural hypotension, hallucination, psychosis, or any other manifestations that are central. So these are the two characteristic adverse effects. And keep this livido reticularis in mind because you may encounter this photo in your exams.